Hello, my name is Lisa Caruso, and I'm working with the Maine Area Health Education Center to develop tools for preceptors within the state of Maine. Today, I'm here with Cate Gaynor to learn about her experience as a preceptor. Cate, could you tell me a little bit about your experience precepting as well as your clinical experience?
Sure, I'm happy to. I'm Cate Gaynor. I'm a family nurse practitioner of 15 years. I'm a graduate of the University of Southern Maine, and I started in rural family care. I practiced with a private DO for the first 4 years of my career. And I would say that I started becoming interested in precepting myself because of the role that he provided for me as in my first job. I was very fortunate to have someone who really took the time to help me to build my skills as a provider once I was out of school. And I saw that that was something that I really felt I needed to give to students who were still in school learning. So I started precepting actually within the first 2 years, kind of right around the 2-year independent mark. I started precepting. I have been precepting through my whole career. I did rural family care, and I had 2 different students there with me over those years. Then I did women's health care for 4 years, and I had, I think, about 4 to 6 different students throughout that time with me. And then I've been a family practice provider at Greater Portland Health for the last 7 years. I've had too many students to actually keep track of at this point here, ranging from NP students to RN students, PA students, and also DO students through the UNE program. I have found it very valuable to precept students from all types of clinical professions. I feel that the nurse practitioner background is really valuable for students to be able to spend time with, how we're able to spend time with patients and how we kind of build the relationship and work through primary care with different patients of different ages, I think is very beneficial to all students. So I've been very fortunate to have that experience across the board.
Very nice. So, Cate, can you tell me, why do you precept? What is it about it that appeals to you?
Sure. Yeah, I'm happy to. I really enjoy the role of teaching. I actually find that that's fundamental in how I practice as a nurse practitioner. When I have the opportunity to take the space to teach one of my patients something, to teach them exactly the kind of management of a chronic illness, to teach them something about the developmental milestones for their infant, to really take the time and the space to teach, is when I see things really connect for patients and their provider. So I enjoy that role. I think that that precepting is teaching. You're teaching a student how to be in space with a patient. I think the critical role that I play as a preceptor is to really have a student watch and learn and build the tools that they will have for themselves to walk into a room confidently, to make space. Our job is to make space to let stories unfold for patients. And I see that that's something that is really challenging when we're in school. We're thinking through differentials. We're thinking through what something is telling us. We're thinking of the next question to ask over and over and over again. And what's next? What's next? That's how a student's brain works. But when you're in clinical practice, the most important thing you can do for a patient is actually make space for their story to unfold and for that trust to happen between them and the provider in the room, because that's really when you move their health journey forward. So I really enjoy teaching how to be a provider, how to sit with a patient, how to sit in the most vulnerable, most difficult moments that someone experiences. And sometimes that is with their healthcare provider. I think that what's great is that all of the thinking and the questions and the differential diagnoses are a part of curriculums. Students get that every day in school. They bring that to me. I help them turn it into how to actually turn that into something you then bring in the room and know that you're doing, but allow, again, the story and the information to come in that moment, in that space, to build that trust with someone. And I really just enjoy teaching. It's a really beneficial part of the work here. This is heavy work. It's heart work, as I tell students all the time. And teaching actually, to me, brings some more joy throughout the day, throughout my day, when I'm in clinic.
Excellent. Thank you so much for sharing. That's a great response. So now I'm going to ask you about challenges. So what do
Sure.
you find is the most challenging part of being a preceptor?
Sure. So, I just talked a lot about making space. So physical space is sometimes challenging as a preceptor, bobbing around between a student, a patient. Sometimes it's a patient and a child. Sometimes it's more than one. Sometimes it's a family. How do you maneuver and how do you get through your day in limited physical space? I kind of see it like how someone conducts an orchestra. You just have to really see how you can move through the day, how you can pick the moments with patients that are going to really engage with a student and let them get through the visits solely, and then pick those patient visits that will benefit strongly from the student really interacting together with the preceptor, with that patient. I think there's just moments where looking through your day, having relationships with the patients that are coming in really will guide the preceptor into knowing what are really wonderful moments for a student to really get in and really own a visit and work through it. And what are visits that the student would actually more benefit from really listening and watching the preceptor walk through a visit with a patient. So I think, yes, physical space as well as time can be the challenge as a preceptor. I think that you want to empower the student to do things independently, but I do think there is a balance in some days to knowing that we have to keep patients on time. We have to respect their time as well. Patients have very busy lives. So taking the opportunity to know when to kind of step in and help guide the student through a visit, help support the student to just watch a visit, really lets that kind of creative orchestrating of the day when you have a student along with you for the ride. So that's I see those challenges. I see, it's really critical to make space for a student outside of the room to ask questions. That sometimes really makes the rest of the day better. So I see that the challenge to get through and stay on time can really be improved by making the space like, okay, we're going to just meet. We're going to meet in this, outside the room. We're going to meet in my office for 3 minutes and kind of talk through how this visit can be structured, what you felt, and kind of just check in. Those check-ins, I think, really help make some of the challenges a lot easier.
That's an excellent suggestion to regroup before you go in and regroup after.
Yeah.
Good.
Yeah.
Do you do anything such as morning huddle as you look at the day together with a student, or any other tips that you would give the audience?
Yeah, absolutely. Morning huddles with your, clinical support staff and your student are critical. I'm just one person of my orchestra, and my MA is really, I like to say, the conductor for the most part. So I want to include the MA and the student together and saying, okay, this is what I see. These visits are here for. This is what a patient is due for. This is the reason for the visit, with also giving some space to knowing that once you walk in, a patient truly might have a different reason why they walked in that day. And in 15 years of healthcare, I've always held that my job is to meet the patient exactly where they are in that moment. And that's what I teach my students. And that's what I really lead my clinical support staff to do. And to know that if we honor what's important to that person in the moment, we can get to the other stuff that we also know is important. So just those morning huddles, those check-ins kind of midday, sometimes too. So bringing back the MA with a student midday, how to regroup for the second half, like if it's a full day clinic, how to regroup to then make sure the afternoon doesn't feel like it's just heavy after a busy morning. How to then kind of bounce back is a good way of saying it. If I can have a student, and I've had students that have worked with me for a long time, if they can pre-visit plan even the week before. Now, in my practice, my schedule can change the moment, right? So you walk in, you think your day is going to be one thing, it's going to be something else. But I will have a student prepare and we'll look ahead for the day that they're coming in the next week and really try to pre-visit plan for themselves as well. I also, what I do when I have students for a length of time, which I think is really beneficial for their growth, is to have them over a longer period of time, is I'll start scheduling, making sure a follow-up visit happens on the day the student's there. So you've made this relationship, you've worked with this patient on this, they're coming back, they're going to come back in 4 weeks and you're going to be here. And we're going to work through how it's very different to follow up on something that you started. So that's something that I also work towards with my students.
Excellent. Great. That's a great plan. So it sounds like you plan out the experiences with them.
Yeah, I try to, really take some moments and see how much growth it can give a student, whether it's a challenging and a hard visit, whether it was difficult for the student themselves, whether it was a very difficult time for a patient, how to then make those experiences add to that student's growth through the time that they're with me. And again, if I can just really create those opportunities of growth, I know that a student will have more of those tools that I was talking about before, of confidence walking into a room, confidence to make space. Some of my job is to tell a student, one of your hardest jobs is actually going to be to stop talking in a room and to let the patient be the one that leads you to the next thing. So, listening, not just to heart sounds and lung sounds, but listening to the story unfold. And that's really where you hear where you need to go with that person who really needs to own their health journey, and you're there to empower that for them.
Excellent. Thank you for sharing that. Great advice.
Yeah.
What about the rural setting? Is precepting different in a rural setting versus a more urban setting? What do you think about that?
Sure. I had the benefit of practicing in rural healthcare for the first 4 years of my career, and the foundation it gave me was so critical to being a whole person, whole family provider. I think that rural healthcare tends to be a patient population that really has been within a practice sometimes for generations. You're seeing, I saw great grandchildren and great grandparents in rural care. And that is so unique. The provider I worked with would know exactly who was in the waiting room by the cars in the parking lot. That was so beneficial to learn how to really value what you can get when you know a family, when you know where someone is coming from, where they're going home to, what that provides you. I think challenges for students can also be that in rural healthcare, you're owning a lot more. There are no specialists to send someone to, right? Or there are, but they're 2 hours, an hour and a half away, or a patient turns to you and say, I'm not driving there. No, you're going to do this here for me, right? So that's something that I think is very different than kind of an urban setting that's very integrated with a lot of specialists and a lot of big groups around them, is how to know when that's still critical, when a specialist really does need to own a piece of someone's healthcare, and also when can you also consult with a specialist just over the phone and keep that patient's care right there for them. Transportation barriers to access, we deal with that both rural and urban for very different reasons, and we have to honor that for someone if they can't get somewhere, that's not care, right? That's not care for them to say, I'm going to refer you someplace, but you're never going to get there. So I think students, learning, really how to manage someone's care, you in a way that they might have to own more, or just really integrate, referrals or specialist care in a very different way into primary care is really important to think through.
Great, thank you. So now my last question. If somebody is watching this and they're considering being a preceptor, what tips or suggestions would you give them?
Sure. Yeah. I would say that, it's really thinking of it that it will benefit your day, thinking of it that it will give you another way of thinking through a situation. I have students and they turn to me and they have all these ideas or differentials or something they're getting from the visit when they make space with the patient. And it's just another set of eyes, right? So it's sometimes I learn something about my patients that maybe they really didn't share with me before, or I didn't hear. So I think it's really, taking away that a student does actually add to the day. I think that the preceptor does have to own a lot of building that trust for their patients, to want to see the student, to want to trust the student. I know that that can take a little bit of time for that, the clinical preceptor to also then navigate that for their patients. But what I find in the end is that it tends to be a lot of fun. The student, watching them learn, watching them grow is really a gift, I think. I really would like the next generation of all providers to learn how to be in space with patients, really empower healing journeys for people, and really be a healer themselves as well as a clinical provider. So I think it's just, what gifts you want to give to the next generation of providers that are coming after us, and also just what gifts you want to give to yourself. So I tend to find that teaching really brings me a lot of joy, and that to me is really important in making this work, this hard work, this heavy work some days, lighter. So I think, take something from it, not thinking of it as something added. What does it give you? And for everyone, I think precepting gives different things to them. But I think it's important for a preceptor to sit there and say, what will this add to me, to my day, to my experience, where I'm at in my career? What can I take from this experience? That's how I tend to approach it. And I really have missed precepting through this pandemic. And I'm really hopeful that I get a student back soon in my, limited physical space. There are challenges. So I really think that a student will actually help provide some healing after giving care through this pandemic. So I'm looking forward to doing it again.
Wonderful. Well, Cate, I just want to thank you so much for taking your time to share your experiences, as well as those helpful tips and suggestions, and for your time and commitment and clear passion for making sure that new students get trained and they get off on a good start within their career.
Yeah, yes, thank you. Thanks. Happy to help. It's something I really enjoy doing. So.